welcome to The Big Picture. I am Tina Jha. Vice President M. Venkaiah Naidu has called for according the highest priority to the health needs of women who constitute nearly 50% of the country's population. Speaking at an event on Friday, the Vice President said, "We will not be able to create a healthy society if the health needs of women are neglected." He said various health interventions must focus on bolstering and meeting women's health needs since they form the bedrock of a healthy society. So on this edition of The Big Picture, we will try and understand from experts why are health needs of women neglected in India and what is being done and should be done to prioritize their healthcare. To discuss these aspects and much more, I'm joined on the program by two distinguished panelists. Let me introduce them to you. I have with me Preeti Sudan, former Health Secretary, Government of India, and Dr. Sunila Garg, Director, Professor and Head Community Medicine, Maulana Azad Medical College. Thank you to both my guests for joining me on this edition of The Big Picture. Dr. Garg, let me begin the program with you. So let's first try and understand some of the major public health problems that women in India are largely facing today and how they vary in urban and rural setups.
Yeah, primarily, you see, one thing which you have to realize is that when we begin from the child itself, we have got 940 girls per 1,000 boys. So the discrepancy starts from the beginning itself. So that means we have got a sex ratio of 940 girls. Ideally, the ratio has got to be more in favor of girls. And if we move further gradually, then we realize that, particularly much more girls, through the process of adolescence, we have got large number of girls, now more than about 70% of the girls who are anemic. And then, when they cross through their whole adolescence period, there is a problem of, menstrual problems which are unaddressed. Then, following that, you said that some of the issues like teenage pregnancies, teenage, bearing of children. And then, the woman who is a teenage pregnant also has got, 3 times more chances of dying as well because of, she delivers early and then, there is more chances of rupture and all that, these are some of the reasons. But, more of the reasons are also social reasons where I was talking to you that why did Mrs. X die? We have so many number of girls, who die, even if, they are, whether they're in the healthcare facility, they reach so late, but their priority is, not so much of the access of healthcare because they're not perceived to be a priority. So when we talk of the rural area, when we talk of urban areas, we have got, problems like gender-based violence, unpaid, kind of care work. And you will look at now, particularly in context of COVID, when we talk of 70% of our women, work is unpaid care. They are not paid for the work, what they do. And this is one thing which goes unnoticed. And also, I will say that, with regard to when she goes further ahead in the period, her both reproductive health needs, her sexual health needs, her pregnancy health needs are all neglected throughout. So that is one thing which we have to keep in mind. We have got about 113 women which we are losing as a result of 100,000 live births, which is something, which is so preventable. So with this, I was involved in a program, Maternal Death Surveillance Response, because it is not only the deaths what we have, it is the underreporting of deaths also, which is there. So that's why we started this whole program of Maternal Death Surveillance Response. But as she goes ahead through her life cycle approach, not only the gender-based violence and all the issues or the economic implications or, the issues of reproductive health tract infections, because I had worked on one of the programs in 80s and things are not very different. 70% of our women are suffering from reproductive tract infections, which may lead to, infertility. It may lead to abortions. It may lead to, different kinds of problems for which, which are perceived as kind of normal, and she is not able to seek health care. So these are some of the issues, So it's a kind of a phenomena. And now when we look in context of COVID-19, we again see that 70% of our workforce is women, which are frontline workers, healthcare workers, or, the laundry women, community health workers and all that. And they do not have access to a simple thing like PPEs and all that. And they become more vulnerable for infections as well. So there is always, an unmet need for her menstrual products while she wears her PPs, or basically there is unmet need for contraception, because again, when you see these lockdowns and all that, we are not having access to the reproductive health supplies or family planning, this thing. So I will say that throughout her life cycle, she is affected more, and in context of COVID-19, we'll say that infected and affected both. So these are some of my initial reactions to your question, Tina. That is it. But it's a very good question what you asked, and it pains us actually with regard to women.
Certainly. So even today, a host of public health problems that women in India continue to struggle with. Ms. Sudan, the thing is, the world over, it's the women who are the primary caretakers that we see. But when it comes to their own health needs, they are the most neglected lot. Why is it so? If we talk in the context of India, what are the factors that are leading even today to this neglect of health of women?
See, I think Dr. Sunila raised a very important issue. The social determinants of women's health are very, very important. So she actually started with gender bias, and I'd like to draw your attention to it. The gender discrimination that started with even before birth, then that cycle goes on. But I think when she mentioned 940 as the child sex ratio, it's heartening for me, particularly because you see, when we started this Beti Bachao Beti Padhao program in 2015, and I was associated with that in January, the child sex ratio was 918. So there has been a improvement, and what is to be tackled is multi-sectoral. So that is why people's mindset, the women's education, then ensuring that there's no child marriage, access to contraceptives, access to healthcare, all these are important. So I think when you say that why is it that women's healthcare is not important, I think we need to ask these questions to ourselves in our own homes. Women are important after all, isn't it? Absolutely. So we need to begin that prioritizing within our homes. And since I've been health secretary for nearly 3 years, I would like to say that there was this realization, and there is that realization, that women's health needs a special focus. We have in India actually been focusing on the maternal care, the child care, but women's health across the lifespan is also important, is what Dr. Sunila said, and I agree with her.
Absolutely. Dr. Garg, so if we look at the context of the current pandemic that we are in, we are seeing it has obviously impacted the lives of billions of people across the globe. But the stress that you talked about on the women particularly has been more because the world over, they are the ones who are donning multiple hats. They become teachers, they have household responsibilities. So in the longer run, if we look at this pandemic impacting women's health, how do you look at its impact on the well-being of women largely across the country?
Tina, this is a very, very important issue because this has got a very strong gender perspective to it. Like you see, as I told you about the about the frontline workers and all that. But another thing which is very, very important is that they are infected and affected both. That means, if they get infection, there is no this thing that, they don't have to take care of the family members who are also infected at home settings. So that is another important thing. Another thing which I will tell you, and which is also a kind of it was a revelation for me, if the woman is, sick and she is admitted, her mean number of days of admission are much less as compared to the male counterpart. So that even if she's suffering from, COVID-19 infection, she is admitted, her number of days in which she is discharged is, are lesser as compared to this thing. But when the moment she comes home, though she is sick, she is not completely recovered. But then again, she has to wear the same hat of, being a woman, being a mother, being a grandmother, being a, taking care of elderlies. Even if there are male members at home, it is the female who is expected to take care of that. And again, another thing which we have noticed is that, under, sustainable development goals and, the targets which we had achieved. Now, if you will see, there are so many dropout children majority of them are girls. You will see that, during this period of pandemic, not many people are able to kind of support the digital education and all that, which is again not in favor of girls, and more of school dropouts we are seeing, in this context as well. Now, childhood marriages, because which we had as Madam Sudan will definitely agree with me, we made a landmark kind of a situation that we had, countered these childhood marriages, and we brought them to a level that, we address this issue of childhood marriages. Now, again, the childhood marriages are increasing in a substantial manner because, it is felt that, now let us get her married and we don't have any sources to support. So that is another part of it. Then also when you see in other parts of though that we don't see in India, but across the world, genital mutilation has increased, again, in which was a part of our sustainable development goals. So some of those issues are very important. But then again, you see under Janani Suraksha Yojana and all, we had, had a milestone of that to reduce maternal mortality. We were focusing on safe delivery. Now, again, that is one of the things, and we have got lot many, initiatives like universal midwifery services and all that. But then, that is only going to happen if she's going to have access to the healthcare facility. And both, rural and urban areas are not the same. And now your healthcare providers are more involved in COVID care. So that is where, her access to the healthcare facility with regard to pregnancy care and everything is compromised. So that's where, the gains what we made in terms of reduction of maternal mortality, we are going to bounce back to the same. And that is going to have very, very, crucial impact on not only, the health status of the society, but the health status of the family as a whole. And ultimately, it's going to affect the health status of nation, which is not a good situation at all.
Absolutely. And this is something that the Vice President has spoken about, Ms. Sudan, that women are the bedrock of a healthy society. We have to ensure that their health needs are given top priority. So obviously, you pointed out there have been several initiatives, there have been multiple schemes that have been brought forth by the government in terms of maternal and child care, which of course are commendable, and all of us have seen how significantly they've brought down mortality rate. But when we talk about promoting better health, regular screening, which is very important, also preventive care, these are areas which require attention. So what are the efforts that are underway towards all of these aspects?
So experience shows that women access health if it is near their homes. Because in their multiple roles that they have, they can take out very little time for themselves. And if the health facility is nearby, they access it. Mm-hmm. And I think there was a very significant step that we took in 2018 of health and wellness centers. So we are going to have 150,000 of them. Already our target actually till March end was 70,000. We completed that, and today we have about 75,929 health and wellness centers. I had the good fortune of visiting some of them in rural areas, and it was most heartening because I saw there that there were more women actually than men, and there were women who were in their 50s, in their 60s, in their 20s, so across a range of age. Why this is important is because you see health, and thankfully I would say India is one of the few countries we are looking at health from the angle of wellness now. And when we talk about wellness, then preventive and promotive health is very important. Therefore, we do 5 screenings at these health and wellness centers, which is for hypertension, diabetes, and 3 cancers: breast cancer, oral cancer, and cervical cancer. I have with me some figures, which again I want to say that which is heartening. Now, if the total footfalls in these health and wellness centers is about 46.4 crores. Out of this, 24.91 crore is women. So 53.7% is women. So unlike what Dr. Sunila said about hospitalization, in the preventive, promotive, primary healthcare scenario, women are accessing healthcare, which is very, very good. And we've had a breast cancer screening for about 2.66 crore women, cervical cancer for 1.81 crore women in particular, because these two are only for women. So I would say that the mantra to ensure that women access healthcare is to have reliable, good healthcare near women. And I think one of the few initiatives that we took, and which is now actually fructifying, is to have, midwifery services. Because what is happening is that now, the entire health profile is also changing. So in more NCDs, non-communicable diseases, these are all lifestyle diseases.
Yes.
And as Dr. Garg very nicely said, that primary health care is given by women basically. We have 10 lakh ashas. We have, I think, more than 25,000 ANMs and all. So now they are also involved in this screening. So if we have trained midwifery services available in rural areas, and with this program of Lakshya, where delivery room standards are set up, where and now private providers are also involved in volunteering services for ANCs. So definitely it will have an impact on women getting better care.
Okay, Dr. Garg, all of these aspects that Ms. Sudan has pointed out are for the governments to do, which they're already doing. These are efforts that have been undertaken in the recent years. But when it comes to women themselves, what should they be doing to prioritize their health? Because a lot of times what we are seeing is, despite the best of facilities available, despite the best of medical innovations that have happened in the past few years, there is a reluctance on the part of women themselves to actually prioritize their health. So what should they be doing to accord that priority which is required towards their health needs?
Tina, a very, very important question. I think I will say that what should we be doing at whatever position we are and at whatever position different women are, unless this empowerment comes from within, and that has to be facilitated by the family members, by the the girl child themselves, or by their husbands, or it's a kind of a overall empowerment which will play a very, very crucial role. Like, let's say minimum 4 of the antenatal visits are required for a pregnant woman, and normally if we see in the urban setup or in a good scenario, we'll see that every pregnant woman should be visiting the healthcare facility once every month for 7 months, then twice a month for next 2 months, and then every week. And we make sure that through these visits, that she is not her anemia is taken care of, she's going to deliver in a proper healthcare facility. And but also she gives birth to a child under the safe circumstances, because we see that lot many deaths which we are talking of maternal mortality are happening during the normal process of delivery. And then if she is going, then it has got implication on the newborns itself also, which we were looking at. It's about 23 per thousand live births. So that is one thing which is very, very important issue. So empowerment has to come from everywhere. It's not only the family setting or the healthcare workers. It's actually the education which brings about, and our education system has also got to be women centric. We talk about different things, and that's where we had a good program also known as adolescent friendly health services, which is still going on, but it is compromised due to COVID-19, where adolescents, particularly female adolescents, are sensitized about their own health issues, and simultaneously the males are also sensitized. So that is where it is important, and that's why we call them as adolescent friendly health services. So this is where we need to look at the empowerment has to begin from beginning. We need to see that if she is we don't have to go for any sex determination or anything, or or sex selective abortions, or during the after the delivery, it is we get rid of the female child because she has fallen sick. And then I have also seen in my rural center visits, I would see that if a girl is suffering from pneumonia, she would not be brought to the healthcare facility. Ye to theek hai, ho jayega. So that kind of a mindset has still not changed, kind of across. So this is where we need to educate even the males in the society, which will bring about a change. Policy is on one side, we need to look at from the policy perspective. We look from the education sector perspective, and I really like the term multi-sectoral coordination. We have got Ministry of Women and Child Development, and let's look at every indicator basically as to how many, from the education perspective, these many girls are there in the area, how many of them they come regularly. I just finished one study on menstrual hygiene, and which I submitted 10 recommendations, and fortunately all of them have been they have been accepted. The girls do miss their schools even during the menstrual cycles. They can't have the changing place and all of that, so they drop out during those days. It is so very kind of I felt that a normal phenomena like menarche or menstruation, which has to be addressed at all goes, so that the women are not going. Second important
Absolutely.
thing,
So I think education and awareness are very, very critical to
yes,
promotion of good health. That's what Dr. Garg is pointing out. Ms. Sudan, so towards spreading awareness, towards educating women to take care of their own health, to bring about rapid change that we are talking about in the women healthcare sector, what efforts are being undertaken by the government?
I think there are 2-3 key issues. First is multi-sectoral action, even in awareness. So I think Women and Child Development Ministry is doing, and even at the field level, identifying local champions. If you can relate, there is a sarpanch, or there is a school teacher, or there is an elderly man who has set an example of encouraging his or her relative, or somebody in the locality. His word, his voice does carry weight. So opinion leaders talking about, local champions talking about these issues is very, very important, and that is actually being done. Number one. Number two, as Dr. Garg also said, and I fully agree with her, even in our school settings, the issues of gender have to be flagged. So we have actually a program of health and wellness ambassadors. This is run in conjunction with health department and with education department, where a training is given to the teachers as ambassadors, and then you have these monitors in the schools who actually will talk to their peers about these issues. So that kind of environment is required. And I think vocalization of the issues, as we are doing today, also is important, because then the issue is always center stage. So policies are there, but action has to be, as I said in the beginning also, it has to be to begin in our homes. It has to begin in our minds. It all begins with our resolve. So let's resolve to make ourselves better, because if women are empowered, if women are healthy, if women, then the whole family and the nation will be so.
Certainly. So concerted efforts required to accord that center stage as far as women's health, their needs are concerned. And this is not just a personal priority, as we've been discussing, but a national priority. In fact, a research suggests, and let me put that across to our viewers, that India and its economy need a healthy women workforce, because increasing women's labor force participation by 10 percentage points could add about $700 billion to India's GDP if all goes well by the year 2025. So there's some real value as well of taking care of the health of Indian women, and obviously for the personal priority, because a lot is riding on the Indian women. They are the bedrock of a healthy society, as our Vice President also rightly said. So with that, I'll have to call it a wrap on this edition of The Big Picture. Thank you once again to both my guests for joining me on the program with us and our viewers. Pleasure having you on the program. Take care of yourselves. It was a pleasure having you on the program as well today. So, and to my viewers, I once again want to make an appeal, as always, do take care of yourselves. We are going through really tough times. Ensure that you stay at home, but if at all you have to step outside, make sure you are masked up, maintain physical distancing, and also keep washing your hands at regular intervals. In the first wave, we have been resilient and the results were there for all of us to see. These are testing times. Let's act together and we will sail through this crisis as well. So take care of yourselves and your families. And that's it from us on this edition of The Big Picture. Thank you for your time.